Hey everyone, let's do some case discussion today. So, I had this female patient of mine who came to me for the scaling and cleaning procedure. And as you can see, she has huge deposits of tartar and calculus around her teeth, especially on the gum line. And due to these huge deposits, if you can see, the gums are inflamed and extremely red at the margin. So, what happens in these cases, because of these deposits stuck around the gum line for quite a long time, when we remove it, since the gums are highly inflamed, the gums like shrinks. Okay, so when the gums shrinks, you feel that there are some spaces in between your teeth. It's not actually the scaling procedure that causes these spaces afterwards, it's actually these deposits that you kept for a long time and resulted in inflammation of your gums and the bone underneath, which caused recession of the gums along with the bone. Once we remove the deposits, we do the scaling and cleaning properly, the gum starts shrinking. And once the gum starts shrinking, coming to its actual width and length, you feel these spaces. So, what I did in this case, I applied this plaque disclosing agent or plaque indicator, not only used for plaque, but for calculus, for tartar, which is the advanced stage of plaque. So, after applying this disclosing agent, I tell the patient to rinse, and then as you can see, there are two colors mostly visible here, which is shocking pink and purple, I would say. The pink color indicates immature plaque, which is a sticky material formed on the surfaces of your teeth within a day once you brush your teeth. That is a mixture of the bacteria, the salivary proteins in your saliva, and the food particles. The blue color indicates hard plaque, which we call calculus or tartar. So, what happens when you don't brush properly, when you don't brush, you don't floss, this plaque keeps like mineralizing and it changes, it converts into much harder deposits, which we call calculus. And as the calculus keeps on growing there, it changes into tartar. So these old deposits which stained blue here. So I show it to the patient to give her an idea what is happening. And we start with the scaling procedure. And once we do the scaling, just for the sake of showing it again to the patient how much of the plaque we cleaned and how much is remaining or not remaining. So I'm applying this disclosing agent again and I tell the patient to rinse, and you can see there are no more pink or blue stains. There is just a little bit staining of the gums around the teeth, and that's because of the inflammation, so that's okay. And that will go away once the patient brushes her teeth. So this is all. And this was an extremely young patient of mine. So I would strongly suggest that please, if you cannot take good care of your teeth, at least go for a 6-month checkup to your dentist, because these inflamed gums, which we call gingivitis, it then converts into periodontitis, which is the main cause of so many dental problems.